Now, before I start with the various presentations, I thought it would be a good idea to tell you that this carcinoma in particular is very aggressive and it spreads very early. So much so that usually by the time the classical features occur, the primary tumor is often well established before we can even make a diagnosis. So most esophageal neoplasms present with dysphagia, which means difficulty swallowing. Other features that we often see are vomiting, which includes hematemesis, and hematemesis basically means blood in the vomitus. And sometimes we can also have melena, which is the presence of a dark-colored stool, which would contain clotted blood. We can also find persistent regurgitation, odynophagia. Odynophagia actually means painful swallowing. I know these terms are quite difficult to sort of remember. Just remember, phagia means swallowing, dys would be difficulty, odyna would be painful. So odynophagia is painful swallowing. They would have retrosternal discomfort. You might see a great degree of weight loss, as you often do with a lot of carcinomas. And advanced disease might actually show signs of extension in the form of coughing, in the form of stridor. Stridor is basically just noisy breathing, choking, and even you might find hoarseness of the voice, which would indicate that the cancer is actually extended to the vocal cords or the recurrent laryngeal nerve. And you might also find cervical lymphadenopathy, which would be a swollen lymph node in the cervical region. Right, so just to summarize the symptoms that we've talked about, they're all things that are related to the esophagus, as we talked about the difficulty in swallowing and the painful swallowing, the regurgitation, and also when we talk about hoarseness and coughing and things like that, these are things which are structures that are in close proximity to the esophagus. So now that we've looked at the clinical presentation, we are going to move on to the investigations. So stick around.